I'm here today with Mariajose from Equal Hope, which is our current Roundup recipient for the month of December. So thank you for being here.
Thank you for having me here.
To begin, can you tell me the mission behind Equal Hope?
So Equal Hope is, it was actually founded by Dr. David Ansel of Rush Hospital. And we noticed that there was a huge difference and inequity in healthcare, especially when it came among to Black and brown women with breast and cervical cancer. So we noticed that there was a huge disparity, especially here in Chicago, how more women in Chicago were dying of breast and cervical cancer than the national average. So our mission was to try to bridge the gap of that inequity and try to make sure that Black and brown women have equal access to medical care.
That's very, very important. Thank you for being a part of this organization.
Thank you.
So, as a healthcare professional, what is some advice you would offer to a prospective employee about serving clients and patients?
So I think in medicine, everything that needs to come, it's better. In medicine, we try to say it's better to prevent than to treat. So the best advice that I can give everyone is to understand that there are some risk factors. I know that there's a lot of us that, especially Black and brown community, believes a lot in holistic medicine and things that we have been passed on over the years. I think we need to make sure that we have both of those worlds combined together, and that way we have equal access to all of the services that we need, and the life expectancy of our community should be longer. So I think for employees that have this diverse community reflected, they should take that into consideration and make sure that their employees also have equal access to care, and make sure that they have enough time to go to appointments and et cetera, and provide a healthy environment for their employees.
Definitely. I'm also interested in health and wellness. That's actually my passion. So I totally agree. Holistic healthcare, balance with allopathy can definitely.
Yeah, we have to create that trust among patients, you know?
Can you actually touch on the percentage of Black and brown women who are affected by breast cancer?
In Chicago, the percentages back in when we first founded the company was 2007, and then we became a nonprofit in 2008. The average amount of women that were dying of breast and cervical cancer in Chicago was 62%. And we have been able to reduce that down to 30% over the years. But we want that number to be, much lower than that. So we try to promote HPV vaccination for young kids to prevent cervical cancer. Cervical cancer is actually 93% preventable through the HPV vaccine. So those are the percentages that we have. We also noticed that a woman in Hyde Park and Washington Park, a woman in Washington Park is 85 times more likely to die of breast and cervical cancer than a woman in Hyde Park. The difference between those two communities here in Chicago is just 1.1 miles. So this is something that we really need to address, because there's socioeconomical issues among all of these different neighborhoods.
And I would have to say it's probably due to access to healthcare.
Exactly.
That's the number one reason.
Into that.
Well, then what are some strategies that Equal Hope will be implementing for outreach and education in Black and brown communities?
So we've been trying to educate the community a lot. We have 3 pillars of our program. Those 3 pillars are advocacy and policy, navigation and education, and the quality consortium. These 3 aspects all kind of get saturated within the community. We either partner up with other community partners, we partner up with clinics around the cities, hospitals. We try to create events, if not be at as many events as possible. We're actually having an event tomorrow morning from 11 to 2. It's a community drive event. We're donating winter coats. Everything's brand new. Toys for the kids. Turkeys, thanks to you guys. We're also providing non-perishables, and we're also providing health information, financial literacy. So these are the ways that we try to engage within the community.
Yep. Yeah, let us know if you need any more turkeys. We still have more. And then my last question, are there any medical services that Equal Hope offers to the community specifically?
Absolutely. So we're a nonprofit organization. So therefore, we're not really a clinic in ourselves. We are a patient liaison service. So we help you navigate the healthcare system. self-advocate for yourselves, educate yourself. So we also help you find access to your free mammograms, free cervical cancer screenings, and we do medical home projects. So those two mammograms and cervical cancers are both free for, because we just want to make sure that you're having preventative services. The medical home projects as well is so if you need access to a general doctor, let's say you don't need a mammogram, you don't need a cervical cancer screening, but you do have other concerns, we help you find access to those. And the first visit is paid by us. So it's not like we're going to send you somewhere where it's too far or inconvenient for you. We have partnerships with different clinics around the city.
Okay. I was going to ask, are there specific locations within the city that people can go?
Yeah, we have a few locations. We have a lot of them. We're partnered up with Esperanza. We're partnered up with Swedish Hospital, obviously Rush Hospital, Roseland, et cetera, et cetera. It just really depends where the patient lives. So we try to make it convenient for the patient.
Okay. No, that's very informative, very helpful. That's actually my last question. Is there anything else you'd like to add about yourself, Equal Hope? No.
I really want everybody to come out to the event tomorrow. I know it's gonna be the weather's gonna be really bad, or unfavorable, but these are such amazing things. The holidays are coming up. We want to make sure everybody's warm. We want to make sure everyone has a plate. We just want to make sure everybody's covered for the holidays, especially because winter, since it's so delayed, and if you live in Chicago, you know, delayed, it's gonna be bad.
Everyone deserves access to healthcare and preventative healthcare, which is most important.
It's just not fair that Black and brown women don't have equal access to the care. And historically, Black and brown women, if nobody got us, we got us. So we just gotta do it.
That's right. All right. Well, then that concludes my questionnaire. Thank you for everything.
Thank you, Jessica. Thank you for having me.